Hello and welcome to Pisgah Health Today. My name is Angela Owen. It's my privilege to host this program brought to you by the Pisgah Health Foundation. The Pisgah Health Foundation is a public 501c3 charity founded in 2019 by a board of 7 caring individuals committed to improving the health, wellness, and lives of Western North Carolina residents. We have 2 special guests today. Our first special guest is Misty Carver, who is the Director of Maple Leaf Adult Respite of Haywood County HHS. Welcome to our program today, Misty.
Hi, thank you.
Of course. Our second guest and coming alongside of her is Lisa Bradley, who serves as the Program Manager for Aging and Adult Services for Haywood County HHS. Thank you, Lisa, for also joining us today. I'm so excited to have both of you ladies to talk about this program here. And so, Misty, why don't you start us off and tell us a little bit about what is the Maple Leaf Adult Respite?
Okay. We are a day program for adults in Haywood County, and we serve mainly people with dementia. We didn't start out that way, but it turns out that those are the ones that need more assistance, more help, more activities, and the caregivers also generally are burned out. They need respite. They need time to do things at home. They need time to socialize with their friends. Some of them need time to work. And so we offer a place where they can drop off their loved ones, and we provide activities. We provide supervision. We have a nurse on duty that takes care of any health needs that they might have, whether it's medication administration or blood sugar checks or ostomy bag care. They need toileting, feeding assistance, transferring, any of those health needs. The nurse there can help with, and we also have a CNA, and she's available to assist in any way that she's allowed to. And we have a social worker, that's myself. And as a team, we can pretty well meet the needs of the people that come, no matter what that is, whether it's a referral to other services in the county, or sometimes it's just a good listening ear. We have people from all different walks of life, all different needs. I said the majority of the people have dementia, and all different types of dementia, all varying degrees of dementia. And then we also have some people that just want to come and socialize with their peers. Most of them are generally in their 70s, 80s, and 90s. And we do have several veterans that come through the Veterans Administration. We contract with them. And we had 4 World War II veterans. So we got to celebrate that. We have several grants that pay for people to come. So generally, payment is not an issue. We have some private pay, so the majority of them are funded through different grants. And United Way helps to support us in buying materials that we need for the agency. And then, of course, the Pisgah Health Grant is going to help us in purchasing the PPE items that are needed for when we do start back. So it looks like we're tentatively scheduled to reopen January 1st. Our health director is very concerned about COVID and our population. And so we have not been open since the middle of March, but we are anticipating January 1st. And with the grant monies, we will be able to purchase the needed PPE items.
Misty, let me stop you right there. This is Lisa. I think that Angela is going to ask you some more about that in the next few minutes. So let's table what we're going to use it for right now.
Well, what I love, Misty, about what you're describing is, you're through the respite, you're meeting such an incredible, important need. something that is really hard, a hard space in life for those who are battling dementia, creating community, which is also something that this year we're all missing a little bit of. And I'm so grateful that you guys are planning for that to come back in and reopen, and completely understand the concerns. We're in a high risk population here. We certainly want to keep people well, but based upon that, so if you look forward out into that January timeframe, how has the Pisgah Health Foundation grant that you received, what specifically is it allowing you to do as you look forward into that reopen time when hopefully you'll be able to get people safely back together?
Well, we are able to, through the Pisgah Health Foundation, purchase these extra items that we are going to need. Without this money, we wouldn't be able to purchase these items and wouldn't be able to open, because now we're coming back into a whole different situation. It's not like how we left in March. We're going to have face masks. We're going to have thermometers. We're going to have gloves. We're going to have gowns. We're going to have extra materials for activities. I mean, there's just so much, and there's no money in our current budget for that. Had we not gotten the grant, I don't see how we could open.
Well, I so appreciate that you're sharing how critical this grant is for helping you guys reposition for open. No one a year ago would have predicted we needed to put things like this into any kind of an operating budget, so to speak, along the way.
Absolutely.
Right.
Absolutely.
Right. So, Lisa, how do you see this program really connecting back into the overarching work that you are leading through the program manager for aging and adult services there in Haywood County? What is this particular work at Maple Leaf Respite really connecting back around to you?
Well, our Maple Leaf Adult Respite program, as Misty just explained, is not only for the participants who need the social and or health model, it's for the caregivers to be able to have time to do what is necessary for them during the day. It's just a brief respite for the caregivers, but without that, we would see a lot of these people be placed in long-term care, most likely skilled nursing facilities. And part of what we do here at HHS is to try and prevent that. We try and put things in place to help all of our aging and disabled folks to try and age in place. We try and wrap as many services around them to keep them at home safely, which in the long run saves our county lots of money and allows us to kind of delegate some of the resources that we have for those who really, really need it to be able to age in place. It also prevents adult protective services, any kind of emergencies or health issues that they can catch at Maple Leaf, and reach out to family members and the primary care physician. It really saves everybody a lot of time and money and puts a safety net in place for those participants.
Lisa, you really have drawn very nicely the interconnected components behind this, that one service does so many more things than we might think about when we just initially look at that as a surface level. And so all of those other pieces that you drew in there. And I personally can just say how wonderful it is to have that respite for caregivers, having been someone who served in caregiving mode for family members in the past. So I certainly thank you both for the work that you're doing there. Well, Misty, before we kind of wrap things up here today, I'd love to hear from you and as well from you, Lisa, on what else would you like our viewers to know? How might they get involved? How might they come alongside and support and learn more about what you do at the Maple Leaf Respite Program?
Well, once we open, we're always looking for volunteers. We have musicians that come in and play music for them. We have storytellers. We have people that show them crafts. So if there's anybody in the community that would like to come volunteer to share some kind of ability that they have, they are such a good group. They love everybody that comes in the door, especially the music. They relate to all different kinds of music. And they just like seeing people from the community, because a lot of times they're stuck in their homes with just their caregivers, and they miss being out and about and meeting people. And we also have volunteers that help us. They don't do any personal care, but they help socialize with them. They'll sit down beside one that's maybe a little quiet and talk to them. So we're always looking for volunteers. If there's anybody that's interested, they can give me a call, and we'll set up a time to talk.
Wonderful, wonderful. I love all those different ideas of getting involved, and I imagine that it's not just about what those people can give in and be a blessing, so to speak, to the people who are there, but you'll get it back in return with the joy that is shared back in those relationships. Lisa, how might people find out where you are and how to get in touch with you, and what else would you add in for getting the community involved and supportive?
Well, I was just going to kind of piggyback on what Misty was saying about volunteers. During COVID-19, it's especially difficult to recruit volunteers to come in and do things. But by the same token, it's more difficult to go out and do outings with our participants. So in the past, we've brought the county fair to we've asked people to bring livestock outside, different things, show cars, different things. So they actually get to experience that. So with COVID-19, it's going to look a little different, but we still want to provide as much of those opportunities as possible. And to contact our center, we have a website. It's Haywood County Government, and you can actually access any of our services through that website.
Fantastic. Well, on behalf of the Board of Directors at Pisgah Health Foundation, I would like to say thank you to both of you for your leadership, and to the organization as a whole for the way that you are touching so many lives over in Haywood County and the impact that you're making. We just really are grateful for the work that you all are doing. You're making a tremendous difference, and whenever things are able to safely come back into to be open, I can only imagine the joy that you're going to be bringing to people as they're able to come back out and have some community and engage back in with you all. So thank you so very much. Thank you both for being here as a part of the program today as well.
Thank you, and we really appreciate the assistance and support of the Pisgah Health Foundation. You guys are absolutely awesome, and so much of our community is benefiting from you guys, and we really appreciate it.
Thank you, Lisa. Thank you. And thank you, Misty. We appreciate you both. We also want to thank Wildflower Media for their technical and creative support in bringing these programs out to you. We also want to thank the Board of Directors and the staff at Pisgah Health Foundation, along with the Physicians Roundtable. So many great people doing wonderful things to serve the Western North Carolina residents. Until we see you on the next Pisgah Health Today, stay well, be well.